Uh, Good afternoon, everyone. Thank you for joining today's webinar on musculoskeletal health. For those that don't know me, my name's Teresa Moss, working for National Highways and the Health Safety Wellbeing team. The meeting will be recorded. You'll receive links over the next couple of days to be able to view it alongside the presentation slides. So please don't worry about not being able to see that straight away. And on that note, I will pass swiftly on to Mel, who's going to intro this. If you do have any questions throughout, please put them in the chat. We'll do our best to answer them throughout. And if not, we'll pick them up at the end of the webinar. Thank you. Mel, over to you.
Thanks, Teresa. Hi, everyone. So today, obviously, we're talking about musculoskeletal risks in the workplace, and for our highway sector in our supply chain, it's actually a huge burden. It's affecting over 12,000 workers, costing us around £200 million a year, and we're losing 600,000 working days a year as well. And the impacts on people are really real. So we're talking about people who are leaving the workforce earlier. There are barriers to retention and recruitment for more diverse labour sources. And of course, the impact on the individuals is a reduced quality of life due to pain and incapacity, loss of earnings, and an increased risk of poor mental health. So as we look forward for our future plans for Home Safe and Well into RIS3, we're going to have a much stronger focus on making the most of existing infrastructure through a greater emphasis on renewal and maintenance of existing assets. And those works will have a greater component of musculoskeletal risk. So due to issues around accessibility and maintainability of our strategic road network. And currently, National Highways doesn't have a huge amount of understanding of that risk profile across our supply chain, but we know from previous work that manual handling risks are frequent and they are widespread in the variety of tasks undertaken in highways renewals, maintenance and construction. So to address the knowledge gap and what we're here to hear about today, alongside with the National Highways and the supply chain, we're aiming through a strategic scientific study to deliver a national musculoskeletal risk profile for our supply chain, which will be used to assess and prioritise future interventions across the network. It's going to cover both high and low speed roads and will provide insight into barriers to sharing and implementing good practice in the reduction of musculoskeletal risks across our workforces. I'm really pleased to hear how many of our supply chain are engaged in this work, many of you on this call, and just look forward to this research supporting us in helping create a safer future environment for all. So I'm going to hand you over now, I think, to Steve to present.
Great, thank you very much, Mel. So I'm Steve Perkins, Managing Director of Steve Perkins Associates, and we're a specialist occupational hygiene, health and ergonomics consultancy working in highways and infrastructure. And as Mel says, I'm going to be talking to you about a national research project on musculoskeletal risk profiling called MRPro. We put this together in collaboration with Mel and her team. MRPro covers the whole supply chain. And I believe it's an industry first in terms of understanding a key occupational health risk in this level of detail. It's a great opportunity for highways clients and contractors to come together on what's a ubiquitous and significant health and safety risk for the benefit of the whole industry. So as always, I want to start with a big thank you to the funders who've made this project possible. National Highways put in 50% of the funds, and then other members of the supply chain have contributed the rest. So Balfour Beatty, Breeding Group, Costain, Connect Plus M25, Telent, Core Highways, Carnell, Traffic Management Contractors Association, Highway Care, Premier Traffic Management and Arcadis. So it's a good range of different contractors and partners there. This project is part of the Healthier Highways initiative, which we actually began as a consultancy nearly 6 years ago, working with Connect Plus and the M25 supply chain. That program has developed into an award-winning ongoing cultural transformation project, basically to value health like safety across both the M25 and we've worked in the wider Southeast region as well. It started small, but it's grown in an evolutionary way, and there are now sort of 5 lanes we talk about, 5 pillars, if you like. Firstly, we engage organisations to raise awareness of health hazards. Secondly, we educate people to improve health protection competence. Thirdly, we prevent ill health through applied occupational hygiene and ergonomics to protect people and businesses. And that means accurate assessment and effective control of the exposure risks they face. Fourthly, we manage health protection to enable a sustainable workforce. That is challenging, as it means changes to policies, bid questions, reporting metrics and the like. And finally, we and our client on the M25 have an aspiration to lead in the industry to improve worker health protection right across highways. And that's why our clients have freely shared Healthier Highways Learning and Innovation. And this is going to, MR Pro is going to fit that model as well. So although there are funding organisations have contributed the money for this, the results of this are going to be made available completely publicly across the whole of the sector. I always find it's helpful when we start talking about health risks just to sort of take a step back and talk about how does workplace health really work. And it's, you know, sometimes people will say, oh yeah, we do health. And I'll say, oh, well, what sort of health do you do? So broadly speaking, there are 3 aspects to health at work. The classic understanding of health at work will come under the banner of occupational health. So that's primarily the clinical arena. And certainly in construction, it's all about managing the health of workers as it is today. It covers things like fitness for work, safety critical medicals and health surveillance, all important things. But the focus tends to be on the state of workers' health now. In highways, that is almost completely outsourced to third-party OH providers. So I won't say they do the minimum, but they do what they're asked to do and paid to do. The second dimension of health at work is workplace well-being. This is all about encouraging individuals to make healthier lifestyle choices around things like exercise, diet, and mental health. Well-being has its roots actually in human resources. The original work and research on it was done by Dame Carol Black, 15, 20 years ago now. And it was all about originally demonstrating productivity benefits for the organization. Obviously, there are benefits for individuals as well. If you feel good about your well-being, then you feel good about your well-being. But the original focus was on productivity. It's probably broadened out, got a bit more fuzzy since then. But the main sort of thrust of it is promoting healthy lifestyle choices, so health promotion, giving people the information resources they need to make better health choices. But what that means is that the onus falls on the individual to do that. Employer provides those resources. It's great to see the emphasis on well-being growing. I've noticed over the last 10 years it's made its way into every health and safety professional's job title now. But unfortunately, no amount of free fruit gym passes and mindfulness sessions is going to stop you dying from silicosis if you're exposed to construction dust for 8 hours a day. So our first priority should always be to do no harm in the work that we actually give our people to do. And that's where the third dimension of health at work comes in, occupational hygiene and ergonomics. This is all about protecting people from workplace health risks. These are the risks the workplace itself creates. They're man-made, entirely preventable, and covered by the Health and Safety at Work Act 1974. This dimension is the province of the scientific and engineering expertise of occupational hygienists and ergonomists. It's not about clinical treatment or health promotion. It's all about prevention and protection. And the reason it's key is that long latency is a massive issue with health. So health stuff tends to be chronic. It builds up slowly over time. Accidents obviously are immediate and acute. And because of that latency period, so as diseases develop caused by work or as musculoskeletal conditions worsen over time, it's no good simply saying we manage health by looking for ill health, because it can take 5, 10, in the case of some lung diseases, 20, 30 years before they fully manifest. And so the responsibility of employers is actually to control the risks not to count the number of cases of ill health. So the focus is on risk control, and that's what occupational hygiene and ergonomics is all about. In fact, if the HSE decided to turn up at your door, they wouldn't ask you how many cases of ill health you've had. They would ask you, what are you doing to control the health risks in your workplace? Just a little about hygiene. You may not have heard of occupational hygiene before. Chartered hygienists are highly qualified applied scientists whose expertise encompasses aspects of physics, chemistry, biology, medicine, ergonomics, toxicology, engineering, epidemiology, and psychology. And obviously, occupational ergonomists concentrate wholly on ergonomics. As with accident prevention, disease protection means the onus here is on both the individual and the employer. So, you know, it's a partnership in terms of managing these risks. So that's a sort of a bit of a simplistic overview, but as you can see, the three circles overlap. There are obviously overlaps between these areas. They're not separate silos, but our focus is on the blue circle as a consultancy. So that's a bit of background to health. Let's talk about why musculoskeletal risks. Mel referred to some of this. Highways accounts for about a third of all UK construction if you think of everything that's done on the roads. The Health and Safety Executive estimates there are 37,000 construction workers each year suffering from a work-related musculoskeletal condition, which basically represents over half of all work-related health in construction. And that results in over 2 million lost working days. So those figures are at the level for the whole of construction. HSE doesn't break its figures down into subsectors like highways. Financial costs of all of that are significant. A report for the Institute of Civil Engineers by Loughborough Uni estimated a £650 million a year cost to construction employers from work-related MSK conditions. There's then a 2023 report for the Chartered Institute of Building that found that 54% of construction leavers over 50, so over half of them, say basically they leave because the work has become too physically demanding. Basically, their bodies just can't cope anymore. And that loss of experienced workers becomes a major challenge when you combine that with skill shortages, an ageing workforce, and the difficulties in recruiting younger people into the industry. And as Mel said, we know there are significant manual handling risks in many highways tasks, especially in the maintenance arena. Interestingly, when you look at the rate of self-reported musculoskeletal disorders in construction, it's significantly higher than any other sector of the economy, and it's not shown any signs of decreasing. And you would have thought with improvements in design over the last 10 years it would have, but no, it's not. And then, of course, there's the devastating effects of MSDs on the individuals, as Mel referred to. Reduced quality of life due to the pain and incapacity, loss of earnings, and increased risk of poor mental health. And also where individuals are at work whilst in pain or with impaired function, they are less effective, reducing productivity and also increasing accident risk. And taken together, that's why the Supply Chain Safety Leadership Group identified MSK risk as one of their top 4 risks under the occupational health significant risk category. So why are we looking at this now? Well, as Mel said, RIS3 is going to focus on making the most of existing infrastructure and assets, so more renewals and maintenance. And generally, existing assets have not been designed with maintenance or the health of maintenance workers in mind. We did quite a bit of work in the southeast region on health by design and looking at some of the places people have to get their bodies into, the positions their bodies have to be in, and the loads and tasks they have to do, particularly around maintenance. You know, lots of MSK risk. So in RIS3, given that increased focus on maintenance, coupled with the issue of older assets, we know there's going to be probably increased manual handling activity and a consequent increase in musculoskeletal risk that needs to be tackled. Now, what happens at the moment is that individual contractors target their own perceived high risk MSK risks, with some trying to introduce personal technology solutions to manage it, or occasionally redesigning equipment or tasks, which would be the better route in all honesty. I'm sure if you want to talk about it, we can get into technology and the place of technology in the Q&A later, but basically technology monitors and manages, it doesn't actually make the job any better or reduce the risk. So that means in risk 3, we're likely to see more attempts at MSK innovation and new interventions, which of course will be a good thing, hopefully, especially if that's sort of design focused. But as Mel said, we currently have no sector risk profile for MSK and therefore no way to prioritize the innovations and intervention. Each one just appears in isolation, championed by a particular company, but with no wider evidence base to justify investment at a national level. And that could be one of the reasons why MSK innovations don't get more widely adopted beyond the original developers. So what will be the overall benefits of doing this research? Well, it'll help us understand the prevalence, scope and nature of musculoskeletal risks and that will include a detailed breakdown of the key risk factors for those top risks. I'll come on to that in a bit more detail in a moment. It's going to enable evidence-based decisions on future innovation intervention proposals. This means these proposals will be more likely to attract National Highways funding in the future. It will highlight examples of good practice in risk control for wider sharing, so we're building up a series of case studies, and hopefully provide some insights on the barriers to sharing and implementing good practice more widely. And it also directly supports National Highways Safety Imperative, the Home Safe and Well strategy, and the Supply Chain Safety Leadership Group Significant Risk 2040 vision, although I've got a feeling that might be 2050 now. I need bringing up to date on that, but that's all about preventing occupational health life-changing harm. Okay, so that's the sort of background to how we got to this point. Let's start to talk about the project in more detail now. So it's called MR Pro, stands for Musculoskeletal Risk Profiling. Will it fix all musculoskeletal risk? Absolutely not. I think we probably need another 10 years and a lot more focus across the sector to do that. So it's not designed to fix all of the musculoskeletal risk, but what it will do is deliver a national musculoskeletal risk profile. It will cover the whole of the national highway supply chain and rank the biggest musculoskeletal risks based on evidence for all on-road delivery. It will highlight and share good control practice where we find it, and as I say, provide some insights into barriers to sharing solutions. Overall, it's about a 12, probably 13-month program running in the current financial year. The technical side of the work is going to be conducted by our occupational hygiene and ergonomics specialists. And as many of you will have seen, there's been plenty of engagement already with the supply chain to basically highlight problems, recruit people for focus groups and all that sort of thing, which I'll explain a little bit more of in a moment. Just give you a quick introduction to the team who are doing the project. I'm leading the team. I'm not a technical expert, but I was CEO of BOHS, the professional body for occupational hygienists, and now run this consultancy. So our technical lead is Dr. Wendy Jones. She's actually on the call and hopefully will be available during the Q&A if there are any quite detailed questions I can't field. She's a chartered ergonomist, an occupational health specialist and a construction worker. She's a published academic who's worked with major projects including Crossrail and Tideway. Then we have Dr. Adrian Hurst. He's a chartered occupational hygiene consultant to multinationals and SMEs across a range of sectors including construction. He's a past president of British Occupational Hygiene Society and the former course leader of Manchester University's MSc in Occupational Hygiene. And then we also have Dr. Carolyn Drake, who's an experienced health and safety professional. She's held senior UK and global corporate roles, chartered member of IOSH, and again, a published academic conducting research in the construction sector. So that's our team, very friendly bunch. So how does the project work? Well, we're about halfway through at the moment. You can see the 8 stages of it there, communication and engagement really running all the way through. We started by looking at the work breakdown structure for highways, and a literature review. We've then moved on to focus groups to create a long list of tasks, long list of perceived high risk tasks right across the industry. We're coming to the end of that now. I think this week we should finish that. We've started looking at e-surveys. That's going to provide us with more detailed information and help us to rationalise that long list. Then we'll be moving into the task scoring phase. This is where my technical people get to grips with various methods, objective methods for scoring risk. Then we'll be doing analysis and reporting, and then we've got a results communication stage, end of Q1 next year, where we'll be running lots of webinars like this, going to conferences and producing lots of information about the results. So that's the overall plan. I'll take you through a little bit more of how that breaks down, how we're actually doing some of those stages. So our data gathering, as I say, began with looking at trying to work out what I term a work breakdown structure for all of highways new build, renewals, maintenance, operations and testing. So that encompasses major projects, regions, basically everything. That was a task in itself, just working that out. It'd be nice if that was all on one big, huge piece of paper, but it's not. That has helped us decide on how we're going to split the focus groups topically. So I'll come on to the focus groups in a minute, show you those topics, how we've broken it down. From the focus groups, we've got the initial long list of tasks, but we'll be going back to, if your people have been in those focus groups, we'll be going back to some of them to ask them for more details as we get into the task risk scoring. But to support that as well, there'll be surveys going out, and mostly the audience in the focus groups has been sort of health and safety professionals, managers, contract managers, operational professionals. And one of the things we want to do with the survey is get down to some of the guys and girls on the ground, so boots on the ground. We'll need your help in getting the surveys filled in. Maybe taking a briefing toolbox talk time to do that, and it'll be an e-survey, and we'll be doing our best to design that to make it as accessible as possible. The work breakdown structure also fed into our stakeholder analysis. So how have we put the work breakdown structure together? Well, I have to say National Highways Procurement and Joe Jarvis's team, Carl Anderson and Greg Burt and all their category managers have been fantastic. We started with, you probably won't see the detail of this slide, but we started with the band and lot structure that they have, the big buckets of money that contracts are awarded out of. That turns out that for SDF and PDF contract, there is a very detailed spreadsheet that breaks down everything that National Highways buy. That has been very, very useful. We've been going back cross-checking with that as we put our focus group structure together. So that covers your sort of PDF and SDF type work. So it gives us the, if you like, National Highways directly contracted view of the work breakdown structure. To that, we then need to add separately major projects view, because obviously major projects have their own supply chain families, and so where you get things that are more likely to happen in major projects, so things like piling, for example, you've really had to go via those contacts. So it's been great to have support from major projects in that, and that gives National Highways non-directly contracted supply chain view. And then finally into that as well, we've talked to National Highways operational regions, and the view there amongst the health and safety people was that traffic officers are the key ones from a National Highways employees view. Obviously you've got people like CAMs and inspectors, but in terms of serious musculoskeletal risk, it's the traffic officers. I will just give a quick plug. We have on Friday, our last focus group is on incident response. And if there are any traffic officers out there on this call, or anybody who can get a traffic officer there on Friday, we really do need 1 or 2 more for that group. We've got plenty of recovery, sort of maintenance contract recovery and incident support unit people, but we do need some more traffic officers. So I'll just throw that one out. You can contact me. My contact details will be at the end of the presentation. So that's how we put the work breakdown structure together. You probably won't be able to see the detail on that, but just to give you a flavour really of the focus groups, all these slides will come out. So yeah, basically we have covered traffic management, road restraint systems, fencing, pavement works, concrete structures, archaeology, landscaping and ecology, marking and studs, road marking, waterproofing, bearings, joints, steel corrosion, piling and embedded retaining walls, drainage, earthworks design, road lighting and CCTV, permanent traffic signs that are non-electrical, road surface maintenance, structures maintenance, ground investigation, general civil, scaffolding, steelwork, incident response and technology. I've asked various people, have we missed anything? And nobody's said we have yet. If you spot anything that you think includes musculoskeletal risk and you think we've missed an area or a discipline, please let us know, put it in the chat or contact us. So that we believe that covers everything in that SDF PDF sheet as well. It's been, I have to say, the focus groups, what my consultants are telling me is the engagement's been brilliant. People have been very willing to share, and yeah, we've had good attendance and good response. As you can see from that slide, we've had over 80 different participating organisations from right across the supply chain, which has been fantastic. Mix of large, small, specialist, generalist, just everything basically. Now, again, this is one where I just want you to sort of feel the breadth of it rather than get bogged down in the detail. But this is hot off the press. This is the initial list of higher risk tasks that are coming out of each of those different focus groups. It's not up to date yet because there's still groups we're running this week where we're processing the information. But as you can see, I think we're up to about 100 or so tasks now. We've got a bit of a prioritization and funding exercise to do. But just to give you an quick insight into the task risk scoring, let me see, where's that chart? Yeah, I'll just jump to this one. So basically, some of you may be familiar, HSE has some published freely available tools called Mac, Art and Wrap, and these deal with pushing and pulling, repetitive, and I can't remember what the other one is, but Wendy will tell you. And basically, there's a huge amount of ergonomic data gone into these tools. And what they are is a list of sort of visual standards for assessing in this particular task, you know, what are the different elements of the risk. So this actual example is taken from some training we did on the M25 where we were teaching the Mac tool in particular, sort of lifting one. And you can see that the different elements include things like load weight frequency, hand distance from the lower back, vertical lift zones, torso twisting, postural constraints, grip on the load, floor surface, and environmental factors. So a range of sort of the different aspects of the risk. And then through these sets of charts, you're able to allocate a score for each of those elements. Those scores all add up and you get a total score at the end. And that allows you to compare that type of task with another example of a lifting task. The other thing that it does, and we found this in the training, was that once people started to think about the different risk elements, it actually became a lot easier to focus them in on thinking about solutions. So sometimes in this particular one, the load this was hinged heavy manhole covers that, you know, technology people have to pull back with some tool. So obviously load is the big one there, but in others, I mean, when you were looking at traffic cones, for example, and the guys on the vehicles passing those and laying those out. It wasn't so much the load; it was all the bending, and then factors like the floor surface and the grip and things like that in all weathers. So what we found was that people were coming back with better solutions by just focusing on the riskiest bit of the task. So basically, there's going to be a library of these breakdowns of each task that will be part of the final report and available to everybody. Okay. So some initial insights from the focus groups, and if you've got any questions on these, Wendy can give you more detail. As I say, we've had a high level of engagement. People seem to have enjoyed the opportunity to discuss this with colleagues across the centre, across the sector, and quite a bit of mutual learning actually. Okay. So we found there are 3 or 4 high risk tasks in most work areas that have come to the fore. Some a bit more, some a bit less, but that's about the average. There are also high risk tasks which are common across work areas. For example, hand digging, unloading tools from vehicles, and lifting and carrying bags of cement. And it does seem to us that current systems for design and construction actually support the status quo. What I mean by that is that musculoskeletal risk is still being designed in, e.g. the installation of chambers which need maintenance access for cables, sometimes inadequate thought for reducing risk, e.g. difficult access, heavy chamber covers where alternatives exist, and obstructions nearby such as barriers, etc. On the other hand, we've also seen good examples of risk being eliminated or designed out. And I'll keep emphasising designed out, because if you really want to fix this sort of thing, that's what we need to do. So, for example, mechanically handled precast concrete slabs for low-level retaining walls rather than traditional curbstones on their edge. We've also seen good examples of training being used appropriately. So, for example, in the archaeology group, one company has done on-site training to teach people good working techniques. And although, you know, that job is musculoskeletal, you're down in the dirt, scrabbling around on your knees, there are ways you can do it that can improve it. We've also found that some disciplines seem to share a lot across their community. Some of the good ones were ground investigation, steelworks and road markings, and those communities do tend to get pulled together by the procurement people, but there are other communities that don't seem to share so much. So sort of the overall picture of how we're going to do the task risk ranking. The starting point is these tools to give us the objective risk scores. We've then got to work out the best way to compare those different methods. The bit that's going to be most subjective really is we need to add a weighting for the frequency with which the tasks are done and the population. So what I mean by that, for example, is you might have a task in scaffolding that, say, on its own is really bad for the individual's body, but when you look across the whole of the strategic road network, it's not done by the biggest population of people, and it's not done as frequently as other things. So things that maybe have less load on the body, cones for example, but actually are done by hundreds and hundreds of people, and they're done, you know, every second of every day. So we've got to come up with a method for weighting for frequency and population. We can cross-check that probably by going back to procurement and looking at spend profiles, which we should be able to link through that SDF PDF work breakdown structure with some of the task groups. So there might be a way of cross-checking it to some degree, but I suspect there's going to be quite a bit of subjectivity in there. And that will give us a final risk profile ranking. We'll probably also present the data in terms of what would be some low-hanging fruit where we could get some easy wins if a task was tweaked or tools and techniques were tweaked, and we'll present it that way as well. So I hope that's given you an overview. I do have an ask actually. What can you do now? We still need help. As I say, we've had great help when it's come to the focus groups. And hands up, I apologise. I've probably sent a million emails chasing people about focus groups. If you've been bombarded and feel a bit bombarded, please accept my apologies. But it's been worth it to get the right people to collect the right data. So what could you do now? Well, we do have a list of MR Pro champions who are people who have basically volunteered to help facilitate our data collection within their own organisation. There's a QR code on the screen there, and also a link. In fact, I'll just copy and paste that link while we're here into the chat, and then that will be available as well. So where's the chat? Okay, there's the chat. Paste, go. Yeah, just a short form if you'd be willing. If your company's not signed up to that yet, we still need help. The things we still need help with are, firstly, encouraging your people who've been in the focus groups to support us when we ask for more detailed information. Because in order to obviously do that MACART and RAP tool risk scoring, we need descriptions, photos, information on high risk tasks, maybe even videos, something like that. So we've still got another chunk of data gathering to do to get that. And also we'll need help of the MR Pro champions to distribute the e-survey to the right people in your organisation and encourage them to respond. I mean, the sort of success of this work is going to be dependent on how widely we can get engagement and participation in that sort of activity. So that will be great. And cheeky ask, I know, we got the funding we wanted, which was great, but there's always room for a bit more funding because there's plenty to do. So if your organisation hasn't yet put a bit of funding in, please, and you're thinking you'd like to, yes, you can. Please feel free to do that. So that's my ask. There's my contact details. If, as I say, if you know how to get a traffic officer on a incident response. Oh, actually, it's tomorrow afternoon. It's not Friday. I tell a lie, but that would be great. Thank you, folks. I can see some of those response forms already popping up. That's great. We do appreciate your involvement in this. I think it's probably time to open it up for questions. Does anybody have any questions?
Brilliant, thanks, Steve. None in the chat so far. So if you do have a question, please raise your hand and I can take you off mute, etc.
Okay, I can see that. Andrew, hi, Andrew. Yeah, I talked about SDF and major projects. How about M&R response contract type works that include cyclic works? Yes. Yes, we have covered those. To answer your question, Andrew, we went through the regions, through the supply chain relationship managers who got us connected with the M&R contract holders in each of the regions. So yeah, gully cleansing. I think we've got. Wendy, can you? I don't know if you can see that question. Wendy, can you?
Yeah, I can. And yes,
have we covered all of that?
Lots of discussions around
Brilliant.
all of those. And they are, yeah, there's some really interesting stuff there, particularly around, yeah, about lifting covers, and particularly lifting covers that have been there for a long time and got really, really stuck. So yeah, we've definitely covered that.
Thank you, Andrew. Thanks for raising that, though. That's a good point.
But I also think Andrew's point about, yeah, how you decide how many you do and making sure that's a reasonable target is a valid point to consider with any work, is how you balance how much you can do to be economically effective whilst not setting it too high.
Yeah, right.
Michael, bear with me. I'll just take you off. You should be able to unmute yourself now, Michael. Michael McIlroy, you had your hand up? if you just unmute yourself on your side, you should be able to speak.
Sorry, thank you. Yeah,
That's okay.
thank you. That was a very interesting presentation, very useful. Just wondered, does it cover hygiene related, such as potentially, in the technology or drainage spheres where you might have rodent infestation and then potential for, coming into contact with Wales disease and that leptospirosis type thing. So have we thought about processes and things to improve that, such as, I don't know, ensuring caps and things like that are on duct mouths and things like that. But and also, just could you give an indication of the champion role in terms of the how onerous it is and the timescales for when it closes, sort of
Can I
thing.
take the first half
You
of that,
take the first
Steve?
bit, Wendy, and I'll do the second bit. Yeah.
So we haven't focused on things like how you would reduce your vials disease risk or the other hygiene things, because we've kept it very, very focused on the manual handling risk.
On the manual, yes, I see.
But having said that, there are additional risks in manual handling and musculoskeletal risk, because if you're trying to avoid, if you're wearing PPE to protect you against other risks, then that potentially increases your musculoskeletal risk. So it does overlap, and we have taken that into consideration where there's particular clothing issues or particular ways of working that might have a knock-on effect. So it has come in that respect.
Yeah, that's interesting. Yeah, I mean, years ago I worked in the utility sector, in the private sector, and yeah, I would have thought that they've got a lot of solutions that, if we've got ways of hooking up into their sort of expertise and their supply chain, potentially we overlap with a lot of that anyway. But I remember years ago in British Telecom, the chambers were designed so that a jointer wouldn't have to bend down to do the jointing. There was leg room below the chambers and so on, as well as special mechanical joints that lifted up out of chambers so that people could work on them, put a tent over it and work over it at the side. So there are things like that potentially that might feed in it somehow, but just sort of come across those in the past. But also, I don't know if it's totally banned now, but years ago, scabbling on pile caps.
I hope we're not.
No, yeah, I thought it's probably been totally banned, hasn't it? But is that an activity that for any rare occurrences still has to happen?
It hasn't come up in any of our discussions, so I'm really hoping that means it doesn't happen.
Yeah.
And generally the risks with scabbling are around hand-on vibration. And again, we've kept the discussions really narrow and kept vibration out of it broadly, because otherwise there's just so many tasks. As Steve said, we've got 100 tasks already. We've kept vibration out.
Okay, yeah.
But yeah, and I think your point around other organisations like the utilities who've addressed certainly chambers and lifting lids and things, it's massive in so many different sectors. And I'm not sure anybody's properly cracked it, but in terms of looking for solutions in the future then, and we're not going to come up with definitive solutions, but we are going to be pointing the way to how things might go forward. And I would agree that there's probably scope for collaboration there.
Yeah,
right.
Great. Okay.
Just to address the second one on the champion's role, it's not onerous. The first part of it was helping us get people into the focus groups, but as I say, the focus groups are coming to an end now. So really, it'll be about getting the survey distributed to some useful people in your organisation. We'll explain all of that and just basically encouraging them to fill that e-survey in. So yeah, it's sort of acting as a conduit for us into your organisation, and that will be done and dusted by Christmas. So yeah,
that sounds good. So like templates covering explanations to go out with emails to contacts will be provided by you.
We provide all of that. Yeah, we provide all that.
Yeah, that's great. Yeah, okay, thank you.
All right, cheers. I think it's
Thanks,
Pav next, isn't it?
Yeah,
Hello,
Pav.
yes.
Yeah, there we go.
Thank you. Hi, my name's Pav Singh, Technical Director in Arcadis. Steve already knows this, but what I do need is the next stage of this project, which is how do we get a feedback loop into design? I've just got a couple of other points of how will National Highways sort of integrate innovation, robotics, autonomous solutions in the whole of life design, where we seem to have a focus on operation and maintenance activities that we're doing here. We do need to have a look at new infrastructure. So Lower Thames Crossing will be doing building of brand new bridges. And so there is a theme of activities like scabbling still exist. So if you look at cross-sectoral activities that are taking place in nuclear, HS2 and various other projects, we will be doing scabbling and standard activities for piling and whatever, because that's the nature of the construction and activities that we need to look at. So my just request is the next steps of this is quite important, if you don't mind, is to say, Steve, if you design or innovation, or what will be the next steps, please?
Hey, Pav, we'd love to be involved in trying to get occupational hygiene insight and ergonomic insight into design, as you well know. One thing that does come to mind, I don't know if Wendy wants to comment as well, but certainly on the M25, they trialled a robotic hydrodem rig. When I think it was joints they were taking out. Obviously that's not new build, but it proved to be excellent, both in terms of the quality of the job and basically removing the human from the hazard. And obviously, hydrodem, there's lots of different elements of risk in that. So we've seen some things like that. I mean, I think Lower Thames Crossing, the ball's in their court. They've got a great opportunity to make some strides on health, and I'm hopeful there'll be a full-time hygienist on a project like that. Did you want to comment, Wendy, at all?
I suppose just to pick up on Pav's point about getting things in at design, is that definitely that's a solution close to our heart, and it has come out of several of the groups. Interestingly, we had one group where we'd covered most of the hazards and were sort of slightly running out of steam, and then I asked the question about, is there anything about design that could make things better? And there was suddenly, everybody just woke up massively and said, oh my goodness, I wish they'd do this, I wish they'd do that. So there's definitely scope, and I think there's also variations. There's some regions and some design companies who are doing a really good job of engaging with contractors, and others where they're not taking it on to the same extent. So I think design engagement and early engagement as well, so early discussions with contractors to identify the best ways of doing things is a hugely effective and hopefully fairly cost-effective way forward.
Yeah, and I'll make an appeal while we're here. We've done work. I think we managed to get a year's worth of funding from the M25 to look at health by design, and then probably a year or so after that, we managed to get a couple of years funding from the Southeast region to take it on further. So we have actually looked at the design process, and we know where health input needs to come, and it really is early, and we also know how. Let's say the challenges for designers around health being that there's hardly anything on it in their training at universities, and they've stopped going out on site a long time ago, so they don't really have they don't have to see what it is that the contractors, the design goes over the wall, and they don't have a good understanding of what it is the contractors have to face. And the idea that a competent contractor just manages the risks is rather simplistic, and getting that feedback loop going so that contractors feel empowered to challenge. And actually, when you really have these conversations with designers, they will tell you that we want it. We actually want that chance because we want to do better, but the whole system isn't set up to make that happen. So I think that's where the real benefits will come, not just for musculoskeletal risk, but for a lot of other risks as well. Okay, is it Maxwell?
Yeah, Maxwell, if you just take yourself off mute, we should be able to hear you.
Hello, thank you.
Hi.
Thank you, Steve. Thank you for your presentation. This is Maxwell from Aston University. I think, Steve, we've met online. We discussed this before.
Yeah, we have, Maxwell. Yeah.
Yeah. So I believe there are a lot of things that we could cover when it comes to technology and innovation. So, for example, I think there are a lot of research which has been done, especially in my research group, with regards to wearable sensors and also using exoskeletons, right, especially for the mitigation of manual handling tasks. And I just wanted to know whether some of these kind of interventions were listed as part of the survey which was done. And then if not, I think some of these interventions should be adopted in construction sites to help workers when they are engaged in these kind of manual handling tasks. So mainly on sensors and then exoskeletons, which I think these two major technologies could help to improve the risks of developing work-related musculoskeletal disorders.
Okay.
I can put
want-
in my
Yeah.
link in the chat, so in
Yeah,
case
please do.
anybody wants to see some of the research that we've done in the group, you can able to find me.
If I can pick that up,
Yeah, you go
Stephen.
for it, Wendy.
Hi, Maxwell. I've read quite a few of your papers when I was doing the literature review for this, so I know quite a bit about your work. And I think you're absolutely right. I think the sensors don't come at this stage. We'll keep doing fairly straightforward assessments to identify the highest risk tasks. But I think in the longer term, where there are particular tasks that we know are problematic, then the use of sensors might be quite an effective way of saying, well, this is how the task is done. How do we change the task to reduce that risk? And I think particularly the variation between how different people do one task, different techniques, and or where you're introducing new control measures and seeing if they actually make things better or worse. I think there may well be scope there. So that would be something I'd be considering as one of the possible, I won't say solutions, but as one of the measures going forward to get more data. I think there's definitely some scope there.
Yeah, I agree. I agree with you, Wendy. So I believe maybe after this discussion, maybe the way forward to me, what I think is to kind of develop some sort of PPEs where we can integrate these sensors as well as other form of like, let's say exoskeletons within the PPEs, mainly to help workers, especially when they are doing lifting, pulling, pushing, and other manual handling tasks. So this is something which I have thought of, but I think we know in the universities we need some funding to engage in research with industry. And then if there's any opportunity, please just give me a shout. I'll be willing to support.
Will do. That's useful to
Maxwell.
know.
Thank you.
Great.
Thanks, Maxwell. Michael, you've put your hand back up.
Yeah, something else occurred to me while I was listening to your presentation that just at the end of that mention of traffic officers, but presumably you've cascaded out to people who manage the traffic officers so that they, because I was thinking, well, all I could do is sort of email some of the traffic officers that I've met who are colleagues when I've been doing my home safe and
all that cascading has been going on.
Yeah.
Yes, I'm now.
Because otherwise it's a bit short notice. So I would have thought that you've probably got the ones that are going to volunteer. Yeah. No, but I was just going to sort of say I could email some of the ones I've met as part of my role as a home safe and well ambassador, but if you've already been cascading, then it's potentially not going to get very many people. But something that thought came up that a few years ago we were having a regional presentation, and one of the high-risk activities that was shared on that briefly just said something about pushing cars. And have you got that activity? Because when I looked at it, I asked about it, and it seemed like the traffic officers sometimes have to get involved with pushing cars. I thought, is this the 1970s or something? How, even my dad, who's civil engineer in the old days, sort of thing, made sure he drilled it into me that you shouldn't be pushing cars. It could end in disaster for your back. Is that activity one of the ones that you've got?
Well, we'll tell you tomorrow, because we've got the traffic officers meeting tomorrow, and it's not me running it, it's a colleague. But when I was talking to him today to say, ask about these, if they don't come up, I've actually put pushing cars on that list to ask about, because I suspect, and I'm happy to be corrected by Mel or Teresa, that it's one of those things that you really avoid wherever possible. But ultimately, if you've got a car that's causing a major hazard, then it needs to go, and pushing is going to be the most effective way to move it, I'm guessing.
Yeah, but we shouldn't as a rule. So
yeah. Yeah.
But I suspect that it happens. So
some sort of innovation, you know, ChatGPT. Think of a tool that can push cars off a highway, and you'll get
absolutely
10 grand reward.
Yeah,
someone will come up
Because
with something.
I think the starting point will be to find out if that is happening, how often it's happening. Is it just something that's once a blue moon, or actually, if we put that in the survey, do we get 200 people saying, "Yeah, I do that"? Then that's something, as you say, that then really needs a focus. Whereas if it happens once a year because there's been something catastrophic going on, that's less of a concern.
Oh yeah, in terms of the population, remit. Yeah, see what you're saying.
I'm just conscious of Wendy's time. Appreciate you.
Yeah, thank you very much.
Thanks, Michael. She's got a dash to do another focus group, but Wendy, I think it might be one for you in the chat actually on office-based stuff. Thought you might want to comment before you go.
Yeah, so there's a question there about office staff and poor DSE arrangement, and it's not something we've specifically had a focus group on. It has been mentioned obliquely in some of the groups that there's lots of risks that come from prolonged sitting. I think maybe one way we could address this, and I'll discuss this with Steve, would be we could include this in the survey so that although it's not the core focus, we can include it so that people who are entirely office based still have the opportunity to identify if that causes them difficulties, and particularly which aspects of it. Is it about sitting for too long? Is it about not having the right equipment? Is it work prep? All sorts of things like that. So I think we can certainly look to include that. I'm also just going to pick up the question from Carl.
Oh yeah, the fitters and technicians.
I know we had you in one of our. I've spoken to you about other stuff, Carl. Did we include fitters and technicians for repairs? That's a really interesting question because it's come up in one group. It wasn't something we've asked about explicitly, but one group did raise it. I don't think the risk. I think a lot of the risks were fairly well managed, but it did come up in one group. So again, what we might do is include that when we do the survey to see how wide that is an issue in other groups, because it's going to happen everywhere. Everybody's using big pieces of kit. So I think that's a very valid point. I think we were talking about changing tyres on tractors. So yeah, that's a very valid point. Thank you.
Right, Wendy, I think we can let you go and zoom off to the next group.
Right. Thank you. But if anybody thinks of anything else, feel free to email me because I get very excited. So I'm very happy to.
Yeah.
Okay. Thank you.
All right.
Bye-bye.
Cheers, Wendy. Bye bye.
Thanks, Wendy.
Yeah. So thank you for all your points and all your questions. We're definitely trying to gather as much information as possible. So some of these pointers have been really helpful, and we'll take that on board. Probably wrapping up now, but is there anything else that anybody wants to just comment or add as we come to the end? Okie dokie.
Do you mind if I just say a few things?
Yeah,
just a
go for it, Mel.
do
Yeah, do it.
So I mean, the sort of genesis of this project was, and it's a little bit related back to some of the comments in the chat and some of the conversations we had, is it's really important that we don't try and sort of find solutions to problems we don't fully understand. So this research just helps us to fully understand what that risk profile looks like so that we can apply the right solutions, the right controls to eliminate or reduce musculoskeletal risk across our supply chain. So, as a final, this risk is a really significant risk, as I mentioned right at the beginning, to our workforce. We are starting through this research to understand what that profile looks like, and it'll help businesses to adopt the relevant and appropriate controls that will either eliminate, hopefully, or reduce the likelihood of that risk causing harm in the way that it's currently causing harm across our sector. And just, a really important point, National Highways future strategy is going to have a really strong focus on health as we move forward and on effective risk management. So this project really plays into those dimensions that we are starting to really care about as part of how we put people to work and how we expect our supply chain to put people to work as well. So brilliant. I'm really close to this project, very excited by it, and thank you to everybody who's engaging with it on the call at the moment.
Thanks, Mel. Once again, thanks, Steve, and thanks to Wendy It's a really exciting project, I think, to really understand the risks that we're facing here. Thank you everybody for joining us today. Really appreciate you taking the time to do so. I think as per the presentation, if you're not involved, you want to get involved somehow, let us know, and I'll send the links out for the recording of the webinar over the next couple of days. So thank you everybody.
And I'll just add, I'll be at Highways UK along with Mel. So if you want to talk in any detail, I'll be around for both 2 days if you're there. See you at the NEC.
Fabulous.
Brilliant. Thanks everybody.
Thanks everyone. Bye.
Bye.